All right, hi everybody. Welcome to session 3 of Explore Tobacco Cessation. We're going to jump right into it. Hope everybody is benefiting from these sessions so far. Today we are going to look into medications and the different types of over-the-counter medications and prescriptions. We're going to talk a little bit more about other equipped methods beyond medications as well. And we're going to talk a little bit about motivation and digging into the different types that can help with quitting. And then I'm going to send along some savings and rewards exercises that are kind of fun to start counting the dollars that you potentially can save from not smoking, and as well as kind of zeroing in on maybe some potential rewards that you could give yourself when you do quit smoking. And then we'll go into the pros and cons of quitting, and once again, kind of zeroing in on that motivation to get you to quit. All right, so we're going to jump into the different quit methods. The first area I want to talk about are the prescription medications. Now, these are medications that you would get a prescription for from your doctor. So the first one is the bupropion, and this is also known as Zyban or Wellbutrin. These are generics, or these come in generics as well. So bupropion does not contain nicotine, which is one of the reasons why it is appealing to people. What it does is it helps to decrease the symptoms of nicotine withdrawal. It's taken every day, and usually you start 1 to 2 weeks before you stop smoking. This helps to increase the levels of the drug in your body before you quit. So that is bupropion. The next one is a nicotine inhaler. This inhaler helps to reduce cravings that can be experienced. Depending on the strength of the craving, you get a various dosage for the inhaler. So how it works is you breathe it in, and then the vapor goes into your mouth and throat, and then it's released into your bloodstream. There's a lot of receptors in your mouth. That's a good area to receive drugs quickly. So that is a good way to go about that quit method. And then varenicline, or otherwise known as Chantix, is what it basically does is it acts on the receptors of the brain to reduce the effects of nicotine. Once again, it's taken before you quit smoking, about a week before, and potentially taken for about 12 weeks. There are some potential side effects that can occur with this one as well as the other ones. And then the last prescription medication is the nicotine nasal spray. This helps to curb nicotine withdrawal symptoms and cravings. It is basically used in the nose like a normal spray. Okay, some other over-the-counter medications that are available is nicotine gum. This is absorbed once again to the mouth membrane. And basically how it's used is you chew it for a while, and then you kind of let it sit in your cheek and let the nicotine be absorbed. The other one is the nicotine patch. This helps once again curb cravings as well. The patch is put on a 24-hour cycle. And then the lozenge is available as well without a prescription. This only has a small amount of nicotine as well, and easy to use, convenient, and once again absorbed through the mouth, and you just let it dissolve. So this one, along with the other prescription medications, I will be sending some more information about these. I'll give you more information as far as the usage, the potential side effects, the cost, and to kind of give you some more information about that. Some other methods that are non-medication are quitting cold turkey. This one is potentially can work. It has various degrees of success depending on the person. I think it just depends on where the person's at, how they're addicted. So this may or may not work. Freedom from Smoking program is available. It's kind of like a session like this for about 16 people, 8 sessions over 7 weeks. It's meant to be kind of a support group. Everybody's kind of in it together. You get some lectures, some group discussions, and then practice some skills. And then there's quit lines available. So one of them is a national quit line through the American Cancer Society. There's one, the American Lung Society, and then there's various other ones. It can be a resource and maybe not a complete method for quitting, but definitely a resource for further information. If you have a moment where you just need somebody to talk to, that is the type of counseling that is available through those quit methods. So moving on to the different types of motivation, everybody kind of is motivated different ways, and there's really 2 types of motivation. One is intrinsic motivation, and this motivation refers to behavior that is driven by internal rewards. The motivation comes with having a sense of satisfaction and enjoyment in completing a task. Intrinsic motivation is essential in establishing a new habit or behavior. And then there's extrinsic motivation. This motivation refers to behavior in order to earn an external reward or avoid punishment. Working toward an anticipated reward provides satisfaction that the task itself does not provide. So extrinsic motivation is good for you to get started on your goals, since you will do the task even if you have no interest, because you are receiving an anticipated reward. So having both of those in combination is really the best, I guess, way to be motivated to achieve your goals. So some people find it hard to get motivated because of various reasons, but some may be from just the sense of not being comfortable. Obviously, it's going to be a process, and there may be some pain involved, some emotions involved with this process, but that sometimes is hard for people to get motivated. Distractions sometimes get drowned out by what you're really focusing on. Trying to do too much or try to, get so much accomplished sometimes can just be hard to get going. Excuses for every reason that you should do something. There's 2 more reasons that it's easier not to, or, finding something else to do. Confusion, maybe not sure where to get started, how to get started, how to, progress. And then the lack of ambition. Sometimes just setting goals and achieving them just may not be what people are adapted to. So kind of getting that going. Some strategies to get started. Where I like to, kind of focus is to start small. Start, day by day, week by week. What can you accomplish today to kind of have those small wins and to kind of gain that that motivation that you can do this, and kind of focusing on those smaller areas. Tell people about your goals. Tell them what your plans are and how you plan to achieve them. Most people want to support you, and especially, down this journey, you're going to find more people that want to support you than that. So utilize that motivation and that drive. Practice positive self-thinking and self-talk. Track your progress. How many cigarettes are you down to? How are you feeling? What's your energy level? What good things have you been doing? What maybe can you work on? Visualize your goals. How do you look? How do you feel? How has life changed once you've achieved your goal of not smoking. Be patient and remember small successes, small wins. Those are the key. Like I said, day by day, just, you know, focus on the here and the now versus the big picture all the time. Seek support, as I said, through your doctor, through various resources that are available, and get excited. This is a really positive thing you're doing for yourself. And once you accomplish this, there's no stopping you. Once you get this done, get this checked off your list, there's just the sky's the limit with what else you can do. Okay, so I'm going to send over a fun worksheet to talk about the savings potential and the rewards that you can potentially reward yourself with at the end of this process, and then kind of zeroing in on what motivates you. How are you motivated? What can get you going? And then next session, session 4, we're going to talk about time to quit. All right, thanks everybody. We'll talk to you next time.